It's the dawn of a new decade. You can be you again with mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Mini dental implants will change your life.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I knew it was time to do something permanent.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Hello everybody, I'm John DeSciullo and welcome to Innovations in Health. We're talking about the mini dental implant, a procedure that will change your life. And I'm welcoming Dr. Donald Brockley and Dr. Ahono Gildersleeve from Brockley Dental Center. And that's a mini dental implant center of America in Butler, Pennsylvania. You can be you again with the mini dental implant. It will change your life. You know why? Because you can enjoy all the great foods that we love here in Western Pennsylvania, in the Pittsburgh area. Imagine digging into those sandwiches at Primanti Brothers and all of the great foods, corn on the cob, a juicy steak, fresh fruits and vegetables. It's a made in America product. We're going to show you why the mini dental implant is so extraordinary. Dr. Brockley, I know the mini dental implant, they say that it's 5 times less. What does that mean?
5 times less means less invasive, less discomfort, less healing time, less visits to the dentist, less expensive compared to traditional implants.
The mini dental implant is a marvel of technology, and we're going to get to meet Drs. Brockley and Gildersleeve in just a little bit. But let's start, Dr. Gildersleeve, with the example in front of you of the mandible, the jawbone, to show us the difference between the conventional and the mini dental implant.
I have here a mini dental implant and then a standard implant here. So what we want to look at is the difference in width. So what makes it a mini dental implant is the diameter. So we have a smaller one in my right hand and then the traditional in my left. So really with the mini dental implant, they really are minimally invasive. It's a much smaller hole and significantly less healing time for when we place these implants.
Yeah, and just the size alone is very significant. You know, the smaller titanium post for the minis versus the larger one for the conventionals. But the length of time that it takes for a conventional implant to work with the patient is significant, isn't it?
Yes, so with mini implants, we can place the implants and the crown in the same day.
Wow, and it's an in-office procedure.
Yes, we do everything in our office, me and my dad.
Yeah, and we should mention that Dr. Gildersleeve and Dr. Brockley are father and daughter, and we'll find out how that works in just a little bit. Dr. Brockley, we're going to talk about dentures now and how that connects with the mini dental implant. You know, a lot of our viewers have lower dentures and they're swimming around on the bottom of the gum and it's very unstable and it's very uncomfortable. The mini dental implant procedure is going to change all of that. Show us why.
Yes, John, that's correct. A lot of people who wear lower dentures find they're uncomfortable, they can't wear them, or they have to use a lot of adhesives to hold those in. And our technique is that what we do is we put 6 mini implants into your jawbone, like Dr. Gildersleeve said, okay, and then we take either your denture, and we can use your existing denture if you're happy with the way it looks and the way it fits, or we can make you a new denture if you want a different look that you would like to have. And then what we do, we put little housings in, and you can see we put little housings inside the denture itself. And then what we do, we take your denture, we put it over the implants that we have, and they snap in. And they're held in there by the implants, and they're very, very strong, and they really are able to help you chew much, much better than you do with your existing floating denture.
And Doc, what's nice is the goop, that adhesive that so many people suffer with, is gone. The goop is gone.
That's true. And by keeping them in place, that you don't have to be embarrassed by them coming out or getting stuck in your food or even having to run to the bathroom to clean it out and put it back in again. So it eliminates a lot of the problems that you have without it being retentive like this is.
So if you're a denture wearer or you know somebody in your life who is, you'll want to tell them about the mini dental implant. We'll show you all the information in just a little bit. But odds are if you have a lower, you probably have an upper denture. And what's significant about the upper denture is the sense of taste is going to come back because the palate is now exposed.
That's true, John. What we do with an upper denture is we do the same thing like Dr. Gildersleeve said. We would place 6 mini implants in. What we do is we either use your own denture or we can make you a new denture. Again, we put housings in just like we did for the lower denture, which snaps onto the implants. But one of the nice things about it is that we're able to eliminate the roof of the mouth, all the plastic on the roof of the mouth, so that way you can eliminate a gagging problem. And also it would really, really help you to taste your food much better than you probably were able to before.
Yeah, because the palate is there and the sense of hot and cold and all the taste. And I know, Dr. Brockley, that plastic is kind of a suction that keeps it up there, so your speech is actually improved as well.
Yeah, it does. It keeps you from talking properly by eliminating that. It would help with that. And also, then what happens then? Then we take and your denture just snaps right in, stays in.
Looks beautiful. And again, that stabilization, it's not going to fall out. Dr. Gildersleeve, I know that there's another level that the mini dental implant has, and you're going to show us the detachable implant bridge.
So dentures and implant dentures, they come in and out at night, but many patients, they don't want to take their teeth in and out. They want them to stay in, and they don't want to worry about them. So that's where the implant bridges come along. So the first one is the detachable bridge. So this one is taken on and off by the dentist at your 6-month cleanings, but the patient never has to take this in and out. Only done by the dentist, and it has the same thing with the housings, and it snaps on.
And what are those teeth made of?
They're made out of porcelain or zirconia, which is very, very strong, and it looks just like natural teeth.
And they look terrific, and this can be for an upper or a lower or both.
Of course, yes.
And you suggest maybe going in every 6 months to get that treatment?
Mm-hmm. You go in every 6 months, have your implants cleaned, have an exam, make sure that everything still looks good, and you don't have to worry about them. These teeth, they do not get cavities. You don't have to worry about gum disease. You don't have to worry about toothaches. You'll never have to get a root canal again. You don't have to worry about those things that many patients have suffered with.
Yeah, that's very important. You know, gum disease can be caused by many different factors, and some of our viewers out there may suffer from that, but the mini dental implant will help that process with the teeth. And if God gave us our baby teeth and our adult teeth, Dr. Gildersleeve is going to show us our third set of teeth with what we call the cemented implant bridge.
That's right. So the detachable bridge comes in and out every 6 months, but if you want teeth that never ever come in and out, we have a cemented option. So we have our nice porcelain or zirconia teeth here, and then it's held in by more implants. So the more implants, the more strong it is, the more rigidity there is to it. So we'll place 10 to 12 implants, and then they will be permanently cemented on. And these teeth never come in and out. These are your third set of teeth. You chew and function with these just like you would the natural teeth that God gave you.
That's terrific, and it's a cemented in permanent piece. Mm-hmm. And I know, Dr. Gildersleeve, we want to feel and look our best. And I know that the mini dental implant will help that. We just talked about the stabilization with dentures, but with these products, you're able to really smile and get into maybe a new job, a new relationship, or bring new vitality back to your life, because that smile is everything, isn't it?
Absolutely. The confidence change that patients have when they go from not having teeth or having loose dentures to having teeth that stay in place like they used to when they were young, it makes a huge difference in their lives.
And I know there's something you wanted to say about older women with respect to bones, because of the osteoporosis that we sometimes hear about.
So many older women, they're not candidates for traditional dental implants, and that's because of the width that we talked about earlier. So with mini dental implants, we can help a lot more patients. We can help patients who've suffered from gum disease, maybe women who have lost bone over the years to osteoporosis. So we're able to reach a much greater patient population with this product, and we love it.
And I love the fact that it can take place in your office. And folks, this is the closest to natural teeth that you can have. And the teeth will never get a cavity, as Dr. Gildersleeve mentioned. And, you know, root canals, you know, all of those things that go with having a dental issue, they're gone. And I want to give you the address for Brockley Dental Center, a mini dental implant center of America. They're at 99 West Sunbury Road in Butler, Pennsylvania. And the phone number to call is 724-200-4701. And the website is brocklydentalcenter.com. Dr. Brockley, I know that some people have teeth in the back of their mouth and they sort of, well, out of sight, out of mind, they're not going to worry about it. But those back teeth are very important. Those are the workhorse teeth that chew the food, get all the nutrients out, and the mini dental implant procedure can fix those back teeth and make your face full again.
That's true, John. Also, if you have missing teeth, they can replace them and make your whole smile feel better too. But what we do is that if you have missing teeth on the back teeth, top and bottom, we can put mini implants in. Okay, by doing so, then we can make crowns that go over the mini implants, and they're cemented in and they stay in permanently to give you a full complement of teeth on the top or the bottom. We can do either. Now, the nice thing about it is that it not only fills in the space so you can chew and function better, because sometimes people can only chew on one side of the mouth. By this, they can chew on both sides. Now, if you happen to be lucky enough to have a flipper that goes to replaces a front tooth, Okay, we can replace the front tooth by putting a mini implant in there, and then by putting a single crown over top of it. The other nice thing is that if you have a partial denture, you know, one of those heavy metal things that have the clasps that go around your teeth and have the metal brace against the roof of the mouth or behind the lower teeth, we can replace that permanently by putting mini implants in, so you don't have to worry about that partial resting against the roof of your mouth or having to come out or having to break and having a tooth replaced. So we can replace them with mini implants permanently so you can actually function and chew and probably look a lot better too.
Well, and what's nice, Dr. Brockley, is these are made in America products. And I know everybody in the Pittsburgh area can appreciate that. And the flipper, you know, we're of a vintage. We remember flipper was a dolphin on television, but the flipper is gone and people will leave your office with teeth.
That's true.
Very important to note.
Yeah, so you can have an implant put in, especially the front or whatever teeth have the flipper on, and you can have that taken out and an implant and a permanent crown in put in the same day.
And that's a custom-made designed tooth just for the patient. So it's conformed, colored, and made specifically for your patient.
We make it the same color, the same size as the tooth that needs to go into the space, yes.
All of that happening in office at Brockley Dental Center and Mini Dental Implant Center of America. They're at 99 West Sunbury Road in Butler, Pennsylvania, serving all of greater Pittsburgh and western Pennsylvania. Here's the phone number to call. It's 724-200-4701. And online, more information at brocklydentalcenter.com. So make sure you give that number a call and check in with the good team over at Brockley Dental Center. And as we promised, we're going to get to know our guests, Dr. Donald Brockley and Dr. Ohono Gildersleeve. Dr. Brockley, how long have you been in practice?
I've been in practice for about 45 years, John.
And I know that there was an inspiring individual who helped make you become a dentist.
Yes, my father was a dentist for 50 years out where I grew up near Lancaster, Pennsylvania.
And now your daughter is now following in the generation, third generation. Dr. Gildersleeve, that must be very special to know that your grandfather was a dentist, your father, and now you. Mm-hmm. How did that work? What inspired you?
Well, I really grew up in the office as a kid. I learned how to file charts, and then on my summers off from school, I was doing dental assisting, and one day I sat down with my mom and dad and I said, I'm going to be a dentist, and I haven't looked back since.
No, and what's terrific, Dr. Brockley, is you work together in the office, and you're sharing all of your life experience as a dentist and bringing all of that to the table. Where did you go to school?
I went to the school at the University of Pittsburgh, and after then I went to Wilmington, Delaware. I worked as a resident there at Wilmington Medical Center. And then after that I joined the Navy for a couple of years. I went in the service, and I was able to help the soldiers and sailors get their teeth fixed up, get their mouth healthy, right before they went to Vietnam. So I was in the Vietnam experience. Although I didn't go to Vietnam, I was there to help the kids that eventually wound up there.
Well, we thank you for your service, and I know a lot of vets out there appreciate everything that you did for our fine men and women. Then you came right back here to
I came back to Western Pennsylvania to help the people in Western Pennsylvania with their teeth and their health, and to give them a better outlook and better self-confidence in their lives also.
And Dr. Gildersleeve, where did you go to school?
Well, I grew up here in Pittsburgh. I actually went to Shady Side Academy in Fox Chapel. I went to college in New York at Ithaca College, and I was the inaugural class at Touro College of Dental Medicine, so that's just north of New York City. And then I did my residency in Buffalo, New York. So I worked with Dr. Todd Shatkin, worked side by side by him. He's been a mini dental implant dentist for over 20 years.
You're bringing all of that great technology that you learn up in Buffalo. And Dr. Brockley, you too are a student of Dr. Shatkin's as well.
Yes, I met Dr. Shatkin about 12 years ago. And by learning about mini dental implants, he changed my practice and changed our lives.
Now, Dr. Gildersleeve, you and your dad are working together to bring the latest mini dental implant technology here. What is it like to work with your dad?
I love it. I go to work every day, and he's a great mentor to me. He knows so much about general dentistry and implant dentistry, and he teaches me more every day, you know, just as much as I learned in 4 years of dental school and a residency.
Yeah, and you're working together, and you have a state-of-the-art facility in Butler, Pennsylvania.
We have cone beam technology, we take 3D x-rays, and yeah, it's important to stay on top of the times and technology within the dental field.
Dr. Brockley, tell us some of the professional organizations. I know you're wearing a pin for one of them.
So part of the being with the mini dental implants, there's an Academy of Mini Dental Implants that we we both belong to, that we take continuing education from, and we go all around the country learning about different experiences and different techniques of how to handle mini dental implants. Also a member of the American Dental Association and the Pennsylvania Dental Association also.
Yep, and a scuba diver, I might add. You enjoy that?
Yes.
Folks, we should make mention that Dr. Brockley and Dr. Gildersleeve are the only mini dental implant center in Western Pennsylvania here in the Pittsburgh area. Brockley Dental Center, a mini dental implant center of America, 99 West Sunbury Road in Butler, Pennsylvania. The number to call is 724-200-4701. And I want to talk a little bit too about the fact that in addition to the mini dental implant, when we go to the website at broccolidentalcenter.com, we find out, Dr. Gildersleeve, that you offer, I like this, from simplex to complex. Explain that with other dental procedures.
Well, we're a comprehensive dental practice. We don't just do implants. So from a routine 6-month cleaning to a full mouth reconstruction, we really do it all here.
Everything that a patient would need, they can find at the Brockley Dental Center. And I know, Dr. Brockley, you talked a little bit about sedation, because some people may just need that extra little touch to get them through the process. Tell us what you do.
Well, John, I learned many years ago that when people came in, they would just come in for one treatment, and then I wouldn't see them again because they're so afraid of going to the dentist. They've had bad experiences. So about 25 years ago, I learned how to do sedation dentistry, and we do that with a pill. We don't do it with any kind of an IV or anything like that at all. We do that with a pill. We put them to sleep, we sedate them, and then we can do a lot of dentistry and fix a lot of dental problems all in one appointment.
Dr. Gildersleeve, I know that you work with Botox as well.
So many patients suffer with TMJ or jaw pain, and Botox is a great way to treat that. So instead of wearing a big bulky night guard, so what we do is we inject the jaw muscle, and it just helps to relax the jaw a little bit so that you don't wake up with aches and pains, because many patients suffer with that.
And I know that there's something called PRF. What does that mean, and how does that integrate with the health care of the patient?
Well, PRF is a surgical technique that we use in our office, and it's a way to use your own body and your own body's cells to heal you. So, for example, if someone had to have a tooth extracted and maybe an implant placed, what we do is we draw your own blood, and then we concentrate it down to get the growth factors and the proteins that help you heal. And then after we extract your teeth, we put that same product, which is PRF, into the socket, and it makes a huge difference. So it helps with post-operative discomfort, it helps with swelling, and it makes you heal significantly faster.
And that all happens in office, and it's the latest technology to help the patient heal properly. Dr. Brockley, you know, a lot of us, we've grown up buying our cars on time, and we pay a mortgage on our home. And I know it's very important to you to make this an affordable procedure for your patient, and you've worked hard to do that.
Yes, John, we like to make our office affordable so that you can afford the work that you need to have done. And we do that by having Care Credit. It's our go-to company to have financing done. And we also make other arrangements too, so that we're able to have it affordable to have your treatment taken care of.
And Dr. Gildersleeve, that is important, because you'll work with the patient, you'll figure it out with them, and they'll make that life change, because it is a life-changing procedure. They will be themselves again, right?
Absolutely. We'll work with the patient. Care Credit has been very helpful to make dentistry more affordable. And, we want them to be able to have teeth and, a smile that they're proud of, that they can use, so that they can eat and chew and feel like themselves again.
Yeah. Speaking of your patients, Dr. Brockley, I know because you've been doing mini dental implants for how many years now?
About 12 years, John.
About 12 years, so you've done thousands of them.
Yes.
I know that you've changed the lives of patients. Is there a story that you can share about some of your patients?
I can, John. Thank you. There was this elderly lady that was in a nursing home, and her daughter hadn't seen her for a couple of years. She had lived out of the state. She came back, and she noticed that her mother's teeth were in really bad shape. Some were broken, some were infected, and her biggest issue was that she didn't look like her mother that she knew several years ago. So she came to our office seeing if we could do anything, and we could. What we did, we placed mini implants on the upper and lower, and put in immediate dentures, implant dentures in, to make her look like what her daughter wanted us to do. And her daughter was so happy to see that she looked like her mother, that she really remembered, and not the lady in a nursing home. Another story I have, John, is that a fellow came in. He was in his mid-50s, and his teeth were in pretty poor condition from periodontal disease, broken teeth again and everything. And his wife encouraged him to come in and have me do some mini dental implants and put in an upper and lower implant denture. And after we put the work in, she started to cry, and she said she looked just like when they were married on their wedding day, the picture of what she remembered he looked like too. And so they were both happy to have all that work done to make him look like he did many years ago.
So maybe they went on another honeymoon. They say that second honeymoons are the best, right?
Could be. I'm sure their marriage became much happier, that's
There you
for sure.
go. Well, it's terrific. You've brought joy and happiness to some people. And Dr. Gildersleeve, I would think the same for you. You haven't been doing as many dental implants, but in the journey that you've had, share some experiences.
There's actually one patient in particular from residency when I was in Buffalo. This wonderful woman came in, and she had an upper denture and a lower denture, and they were loose. And she hated how the upper looked. You know, she thought it made her look, you know, juvenile, like children's teeth. And she decided to get implant bridges, cemented implant bridges. And when, you know, we cemented them in and she saw her smile, she started crying, and, you know, she was so happy, and she left a huge impact on me. And this was in Buffalo, so the first thing she did, you know, for dinner that night, she went out and got buffalo wings, and she had no complaints. She was extremely happy.
Great. I wonder if they were hot buffalo wings. You never know. She could try it. Well, let's hear from some other patients whose lives have been changed as the result of a mini dental implant.
If you're concerned about your looks, then obviously this is the way to go.
I just can't say enough about how I feel.
How could you go wrong?
I'm able to talk and speak with confidence again.
I feel a lot more confident. My smile feels better.
It's one of the best things I've ever done in my lifetime. I mean it sincerely.
When I go to the VA, I can give them a big old smile.
It's just amazing what it does for your self-confidence and how you feel about yourself.
After the procedure, wow, yeah, you smile.
And now I smile all the time.
I am very happy I had the procedure done. I feel as though I have my smile back.
It's just unbelievable what it's done to my life.
Now that I do have the mini dental implants, it really has a positive impact on my life. It really has.
It kind of gave me my life back.
I feel like I do have more confidence than I did before.
It's going to sound corny, but I mean, it is a life-changing event.
Changed my life.
Great to hear from those people whose lives have been changed by the mini dental implant procedure. It's 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. And that's all because Dr. Donald Brockley and Dr. Ahono Gildersleeve will help you at the Brockley Dental Center, a mini dental implant center of America, 99 West Sunbury Road in Butler, Pennsylvania. The number to call is 724-200-4701 and online at broccolidentalcenter.com. Now, if you've been with us for the whole half hour, we really appreciate you watching Innovations in Health and meeting our great guests. And you're learning about the mini dental implant procedure. If you joined us halfway through and you're thinking, well, what is the mini dental implant procedure? I heard a little bit about it. The models that we're going to show you briefly will really bring it home. So, Dr. Gildersleeve, let's start with that mandible again and show us the difference between the conventional and the mini.
So this is the mandible, or the lower jaw here, and we have the mini dental implant on this side, and then the standard, or the traditional implant, on this side. And what we see is the difference in width here. So we place the minis here, and they just have a small pilot hole that we go through.
And that's incredible because that's a titanium post that goes in, and then the bone actually goes around that post when it goes into the gum and the bone. And it's such a small incision, and it doesn't take as long, does it?
That's right. We can place implants and then put a tooth or a denture on that very same day.
Same day. And speaking of dentures, if you have a lower denture that's swimming around on the bottom of your gums and you don't have stabilization, well, the mini dental implant procedure is going to fix that, right, Dr. Gildersleeve?
Absolutely. So we place 6 implants on the floor of the mouth, and then we snap the denture in. We have housings that go on top, and then it just goes in and snaps just like that for the lower.
And the adhesive that all of you may have been using if you're having dentures, that goop is gone, right, Dr. Gildersleeve?
That's right. No adhesive is required. These snap in and they give a good amount of rigidity, and you can trust that they're going to stay in there.
Well, the confidence that we love to eat, the foods we love here in Western Pennsylvania, all of that's going to come back with a great taste in the upper denture example.
That's right. So many patients complain when they have an upper denture of the roof of the mouth. You have a lot of taste buds and they're covered with a traditional denture. So we've eliminated that with the implant denture. And once again, it just snaps on just like that.
And that confidence level's back. The denture's not going to fall out. You're going to enjoy those family functions in Pennsylvania and anywhere you go with great confidence. Dr. Brockley, there's another step up, isn't there? Because we'll call this the detachable implant bridge, and it has a great look. What is that?
There is, John. There's a step up from the dentures, and we do call it detachable because once it's in, it snaps in like this, and it doesn't have any of the plastic around like the dentures do. And then it's detachable because it stays on. You don't need to take it out. Once every 6 months or so when you come to the dentist will take to our office. The dentist will take it out, clean it, and put it back in again. So it's really a nice step up from the denture part.
It looks beautiful, and it could be upper or lower or both. And if God gave us our baby teeth and our adult teeth, Dr. Brockley and Dr. Gildersleeve are going to give us our third set of teeth. Dr. Brockley, this is called a cemented implant bridge.
Yeah, that's right, John. An upgrade from the detachable bridge is that what we do, we place several more mini implants in, and then we can make you a beautiful cemented bridge out of porcelain and zirconium. And what we do, we take this and we actually cement it in with permanent cement so they never come out.
We talked earlier about some of those teeth that are in the back of your mouth, and if it's out of sight, out of mind, it shouldn't be, because those are the teeth that get the nutrients, all those great foods we love. You're biting into the steak, you're chewing into that apple, you want to chew it good, but if you don't have teeth in the back to do it, it's not worth it. But the mini dental implant will fix that, Dr. Gildersleeve.
That's right. So we don't just do dentures and bridges. We do individual teeth, or however many teeth are missing as you need. So what we would do is, say if you were missing several teeth in the back, place several implants, and then a bridge is cemented directly on. These do not come in or out. And then say you have a front tooth, maybe you have an accident, you're hit in the face with a basketball, something like that. Front teeth can be replaced, and they can be replaced immediately. So an implant, and then the crown is cemented directly over top, and it matches the natural teeth that you have.
Dr. Brockley, these are practically pain-free procedures. When you talk about pain, it's really an over-the-counter medication if needed at all once it's done.
Yeah, generally it is. There's very, very little discomfort and less healing time too. And so we just need to take some ibuprofen or Motrin or Tylenol or whatever you normally take for a headache. Should take care of the problem for you.
So final question, Dr. Gildersleeve, Dr. Brockley, we'll start with you, Dr. Gildersleeve. What do you think is the most important piece of your practice?
I think overall it's that we provide comprehensive, full dental care, whether it's for children, for adults, for the elderly, whether it's implants or fillings. And we do that in a place where patients don't need to be afraid to go to the dentist anymore.
Dr. Brockley?
John, I think the most important thing for me is so people can not be afraid, have a healthy mouth, have a beautiful smile, have wonderful self-confidence, have a wonderful time with their family and friends. And we want them to, well, you can be you again with mini dental implants.
They certainly can be, and you are changing lives one patient at a time. And you are innovators in health right here in Pittsburgh and Western Pennsylvania. Dr. Gildersleeve, Dr. Brockley, good luck to you, and thanks for joining us on the show.
Thank you, John.
Thank you, and thank you for watching.